In the ever-evolving world of beauty and aesthetics, few topics generate as much conversation and controversy as Botox and dermal fillers.
So we are so thankful Dr. Sethi from RenewMD Medical Spa is joining us to debunk some of the myths and educate us on the facts when it comes to these treatments. Dr. Sethi, it's always so fun to see you here.
Well, thank you. This is a fun topic because I'm going to ask you questions that patients often ask me.
Okay.
And we can test your knowledge of myth versus fact.
Okay. I'm scared.
Are you
Jess.
ready?
I don't think I'm going to know anything.
I know. Let's see what we know.
Well, let's start with fillers, dermal fillers. Can they only add volume to the face, or are they also useful for contouring the face?
So can fillers
only add volume to the face?
only add volume?
Make them fuller.
I think that's false because they
can add contour.
Yeah.
I'm going to say yes.
Absolutely. Fillers, when you look at people who looked overfilled, they are in fact overfilled and their work is, maybe the work has gone overboard. But we use fillers very frequently in all ages to contour the face better, to also contour the jawline. So they are a contouring type of treatment.
Okay.
Let's go to our next one, which is Botox freezes your face, making you look expressionless.
Hopefully not. Not if you go to Dr. Sethi.
Right. That's going to be false.
Yeah, that is the right answer. Yeah. No, yes, sometimes when you look at someone and they look like they've had Botox, it's one of those situations, again, where likely they have, and maybe too much or in too many areas. But typically, the goal of Botox is to stop expressions in the face that we don't need. So that's like frowning, scowling, and a lot of times people who are doing these expressions are doing them when they're reading, concentrating. So it's not when they're actually trying to express an emotion.
Okay.
So someone with Botox should be able to look pretty natural.
Okay.
All right. Good to know.
Yeah,
That's perfect.
You're not just completely frozen.
Yeah.
Exactly. And now this is the other one, which is a very common one. Fillers can only be used to create, or fillers only create dramatic changes in the face.
Dramatic changes. I'm going to say false because you should be able to do small tweaks is my guess.
Yeah, maybe just a little bit of filler, not too much.
Exactly. So, and then, so this is again, very, very common misconception where people will come in, and we recommend an enhancement of their features with a filler. And the first thing they say is, give me just a little bit. I don't want a dramatic change. But, if you look at some before and afters, you will not. First of all, you will never think that a filler accomplished that. And they are designed for nice, subtle enhancements and improvements, not for dramatic changes. And when you do see dramatic changes in celebrities, likely they've had too much filler very frequently over a period of time, because fillers stack on each other.
Okay.
So yes, common misconception. Botox and fillers are only for wrinkles.
Botox and fillers are only for wrinkles.
False. Because if you have a place maybe it's too deep in, you may want to bring it up some, but not always a wrinkle, right?
That's correct. So whenever people think of Botox or fillers, they're thinking of age-related changes that are addressed by them. Actually, so let me start with Botox. Botox is used for many, many reasons. Of course, first and foremost, wrinkle prevention. But interestingly, we can use Botox in a lot of medical aspects. So reduction of teeth grinding, which will ruin your teeth and also causes the face to widen. Decrease in perspiration in armpits, hands, and also for upper back pain, migraines. Those are all
migraines. I've heard of the migraines.
Wow.
Yeah.
Yes, those are actually commonly used indications for Botox, and we do them in a medical spa setting because many times they will have an aesthetic effect on you. So we do see that. And the next is fillers. So again, fillers are not only for people as they age, but also for enhancement of natural features. So fillers in the lips, fillers of the jawline. These are natural enhancements that people in all age groups are using.
Okay.
Wow, so many different uses for that.
Yeah.
Cool.
Let's go to another one. Injectables, Botox fillers, can enhance natural beauty without anyone knowing.
You hope.
Yeah, true.
Yeah, exactly. That was it. I guess in this order, it's the easy one.
Yeah.
Yes, exactly. And I'm just trying to bring that point forward. You know, again, we've heard of a lot of celebrities who've gone and reversed their fillers. And I think the general rule of thumb is fillers are great for filling. So if you're using them in that context and you're using them conservatively, you are going to have an excellent result. And you are not going to look like you are not yourself. But if you use fillers to start lifting different parts of the face, you can actually start looking maybe a little too full. So it's a balance.
Okay, so you always want to start off slow. I think we have time for one more if you have another question.
Yes, I do. Fillers make everyone look the same and don't account for people's native facial features.
I think this has to be false. This is not what anyone wants.
That's right.
Right? Yeah.
Yes, this is an easy one given our discussion today. But yes, you know, one of the things, and this does get asked of us in a medical setting. Can you give fillers, or can you add fillers to make me look like this celebrity or this person? And you know, the answer to that is not always yes. You have to take into the account a person's natural features, whether they have high cheekbones, their chin, is it recessed, not. So it is something that has to be native to your face to start with.
Okay, these are all such helpful tips, Dr. Sethi. If anyone wants to get in touch with you to discuss, possible treatments, what's the best way to do that?
So you can find us on RenewMDWellness.com and follow us on Instagram, RenewMD_beauty. And for our discussion on fillers and Botox, we have a lot of before and afters. And I would urge you to try and ask yourself, does this person look better? The same? And yes, we display our work excessively. So please check that out.
Yeah. Wonderful. All right. Well, thank you so much, Dr. Sethi. And of course, we will link that on our Instagram as well. So you can always find her page. To learn more, you can head to Dr. Sethi's website. Again, that is RenewMDWellness.com.